regardless of what you're working on, you can usually divide the course of treatment for your problem into 3 stages. The first stage is symptomatic. So let's suppose it's migraines, right? We want to get your symptoms to be less severe and get you to a point where you're having migraines less frequently. So let's say when you came in, you were having not only pain, but nausea and other problems that come along with migraines a couple of times a week, and it would last a couple of days. We want to get you to the point where it's not happening every week anymore, and it's not lasting a couple of days or even one day. At that point, we continue to work on the problem, but we go more to the root cause. So let's say in the preliminary stage, we identified your gallbladder channel as the culprit. That's a common one. That's the one that gives us headaches behind the eyes and in the temples and in the upper traps. And that person might also have sciatica, or might also just be stressed out and have jaw pain. So we address the gallbladder channel. At the next stage, we're dealing with the root cause. So that's where we say, okay, why is this happening in the first place? Let's go a little bit deeper than the gallbladder channel. We're going to continue to look at the channels. We're going to look at Chinese medicine. And the only difference is we're addressing the root cause. This stage, you can usually gauge the length of time that this root cause part will take. It depends on how long you've had the problem. So let's say you've had this problem for a couple of years, it shouldn't take that long to address the root cause. If you've had the problem for 20 years, it'll take longer. The next stage, okay, once you've got the root cause, it might not be completely addressed, but it is resolving because you've put in place lifestyle changes, dietary changes, you've done acupuncture, you might be doing qigong or exercising, you might be taking supplements, right? At this stage, it's resolving and you've got it well under control. So that's when we can go into just the maintenance stage. At that point, you can come in less often for treatments, and really it's a wellness visit. When you come in, it's just preventative, and you're doing pretty well at that point.